Hi everyone, a little bit more today on ligament injuries, and we're going to use something that we see a lot more commonly being the lateral ankle sprain as well. We're going to talk a little bit about patient positioning, but then also discuss some of the protocols around how you might undertake ligaments injury treatment there. Hopefully this will help you to provide a more comprehensive treatment to your patients and really start thinking about, okay, what do I need to consider before I, start undertaking this treatment there. Really what we're wanting to do is get that patient in a really good position initially. That might mean internally rotating their legs so that we've got a more appropriate, face straight onto the laser. And if you, with your own handheld device, might be, undertaking that a little bit differently. We need to really consider about your ergonomics as well. So have that chair high, maybe tilt them back a little bit so that you're in a comfortable position. Now, when we're looking at that, we really want to start thinking about, okay, we need to really work on reducing that swelling and maintaining all of our range of motion. Now, for us with an MLS M8, I'm going to be reducing that swelling through an anti-edema type setting and then maintaining, their range of motion through a contracture setting. Now, these are both going to really help to increase the blood flow more generally and reduce that swelling, but also maintain the range of motion moving forward. Now, after several sessions of the anti-edema, you may start then look at something that's going to just increase the healing rate, increase the blood flow locally, and so then you might consider something like a biostimulation setting on the MLS M8, but there's maybe different settings on different devices as well. If there's muscle tightness through the lower leg, really start thinking about, okay, well, now our perineals are overactivating to try and compensate. We need to start thinking about that muscle belly and, undertaking some trigger point aspects there, as well as just releasing it generally with a contracture setting. But let's take a bit of a look at, how that is in this case. So, really nice and broad over the area of pain, over the area of the sprain and the swelling. And you can see that I'm, even going up to, really high ankle here. This is sort of looking at a ATFL or a CFL type injury, but really understanding that there may be some ankle joint effusions, there may be some other things happening there as well. So we really want to make sure that we're not missing anything. That anti-edema and that contracture is what we've just seen here. Really, start thinking more broadly about, where the different aspects are going to be coming from. And if that is more proximal, do treat more proximal as well, because it's important to, not miss anything and whilst we're treating holistically. So this is something that I found to be really effective. Really look at that protocol, look a little bit further proximal, and then start thinking more broadly with regards to, maintaining that range of motion. And you might do some movement based sort of PBMT as well. And then building out from there, make sure there's no proximal entrapment that's causing concerns as you're looking at that biomechanics. Reduce the swelling, decrease the pain, ensure that range of motion is maintained, and then of course looking at the biomechanics and treating holistically. But today that's been ligament injuries with a particular example on that lateral ankle sprain. Hopefully this has helped. Cheers.